Good evening. I'm Reverend Liz Walker. I am pastor of Roxbury Presbyterian Church, and I'm the executive director of the Cory Program for Post-Traumatic Healing. Welcome to the fourth series we call Coping in This Season of COVID-19. Tonight, we're going to raise some tough questions about the vaccine to COVID-19. One of the reasons that cited for the hesitancy among African Americans in taking the vaccine for COVID-19 is what happened in Tuskegee, Alabama. Tonight, we look back at the horror that began in 1932, when more than 600 African American men were unknowingly used as part of a study on the effects of syphilis. The study was sponsored by the U.S. Department of Public Health. It was a horrendous violation of ethical standards, a violation of human rights, and one more example of the savage racism that is the history in this country. What happened that year and those many years is still impacting African Americans. So tonight we're going to talk about that, the effects of the Tuskegee work, the Tuskegee injustice on what's happening now, and the lessons that we can learn. My co-host tonight for the questions that we will raise is Reverend Dr. Gloria White-Hammond, co-pastor of Bethel African Methodist Episcopal Church. She is a medical doctor. She is a member of the Boston Mayor's Task Force on Healthcare Equity and a Swartz resident practitioner in ministry studies at Harvard Divinity School. Our special guests tonight are all descendants of one of the men in the study in Tuskegee, and now they are a part of the nonprofit group created to preserve the legacy of all 623 men. Lillie Tyson Head is the daughter of one of the participants in this study, Freddie Lee Tyson, and the president of Voices of for Our Father's Legacy. Carmen Head Thornton is the granddaughter of Mr. Tyson, and she is a member of Voices and director of grants and workforce at the American Academy of Child and Adolescent Psychiatry. And Dr. Betty Neal Crutcher is the niece of Mr. Tyson, and she is the head of the scholarship committee for Voices for Our Father's Legacy. We want to welcome all of you tonight to our town hall, our webinar, to talk about this history. But before we get to the conversation that's so important tonight, we're going to do two things. First, we're going to take a poll. It's a poll we take all the time, every time we do one of these Zoom conversations. And the question is, as it stands right now, are you planning to take the vaccine? This shouldn't take but a few seconds for you to decide, and we're going to give you the results of that poll right away. This has been a very interesting poll because it has shown some of the hesitancy in our community and around the country of people who don't think it's right now time to take the vaccine, but these numbers have slowly been changing. So Judelle, you tell me when you got the results of that poll among our nearly 400 people. Wow, that's pretty good. That's very effective. That's very positive. As it stands right now, 89% of the people on our poll are saying they will take the vaccine. 11% are saying no. So the numbers have definitely changed. We're going to take that poll again at the end of this evening. The next thing we want to do is to really kind of show you the story of a short version of the story about what happened in Tuskegee, Alabama, beginning in 1932.
In 1932, the United States Public Health Service was in Tuskegee, Alabama to study the natural history of syphilis in hopes of justifying treatment programs for Blacks. It was called the Tuskegee Study of Untreated Syphilis in the Negro Male. The study initially involved 600 Black men, 399 with syphilis, 201 who did not have the disease. The study was conducted without the benefit of patients' informed consent. Researchers told the men they were being treated for bad blood, a local term used to describe several ailments, including syphilis, anemia, and fatigue. In truth, they did not receive the proper treatment needed to cure their illness. In exchange for taking part in the study, the men received free medical exams, free meals, and burial insurance. Although originally projected to last 6 months, the study actually went on for 40 years.
That's just an incredible story, just a horrendous story. And I'm glad that you are all working on telling us about the impact of that story on you. And so my first question, and on the nation, my first question is to you, Miss Lillie Tyson Head. You want to clarify something. Everybody refers to this as the Tuskegee study. I do. I read about it in the newspapers. I hear about it on TV, but that's not the accurate name. Could you explain?
Yes, I'd be happy to. But before I explain, please allow me to thank you on behalf of Voices for Our Father's Legacy Foundation for hosting such a town hall of meeting. I appreciate that. And I also appreciate everyone who has joined us this evening. In clarifying the name of the study, in the years following the disclosure, the Tuskegee study became the preferred name for the long and complicated history and medical research of African Americans without their consent. We can all agree that the name of something or someone gives them identity, ownership, and begin to tell their stories. The names Tuskegee Syphilis Study and Tuskegee Experiment is sometimes confused with the Tuskegee Airmen Experiment, which is something that is totally different. Placing Tuskegee at the front of the word study implies that the study was done by Tuskegee, and placing the ownership of the study on Tuskegee instead of where it belongs. Part of the foundation's charge is to transform the study's legacy, and it begins with correcting the name. The Tuskegee University National Center for Bioethics and Research in Healthcare believes that we should be truthful and use the study's right name. The correct name, and what I hope we will start seeing and hearing it referred to, is the United States Public Health Service Syphilis Study at Tuskegee and Macon County, Alabama. The correct listing of the study name now can identify the owners and allows for accountability and reconciliation. And Macon County includes where the men lived and their families, and where the impact was mostly felt.
Well, we thank you for clarifying that. And that is important because we're throwing it on Tuskegee and you're saying, no, let's throw it where it needs to be thrown, which is
absolutely. Absolutely.
Thank you for that clarification. Reverend Dr. Gloria, I know you have a question.
I do have a question, and thank you again, really each of you, for the work that you're doing and really redeeming the richness of your father's legacy. I have a question for you all, let's say for you, Ms. Head. When did you find out the truth about this study?
I'm sorry, I didn't hear. Was it when?
Or when and how did you find out the truth?
Okay. All right. My father found out about the study, like most people in the world, actually, found out about the study through the media. My brother Wallace, who lived in Texas at the time, he was a sergeant in the Air Force, and he had read an article in Ebony magazine in the fall of 1972 about a study that had happened in Tuskegee amongst the Negro men. And he asked my father if he knew anything about it. My father told him no, he didn't know anything about a study. And then he went on, my brother went on to tell him that, well, they said they came around to different communities there and took blood samples. And my father said, well, yeah, I did give some blood samples, but I don't know anything about a study. So about 2 days later, someone from the CDC called my father and confirmed and told him that he was one of the men in the study. And it was very traumatic and very, I guess you could say it was devastating for us to hear that he was in that type of study. You also have to realize that at that particular moment in doing those few days, we didn't know much about the study. We didn't know what it consisted of or so forth. And afterwards, we had to read and research over years of finding out more, about what had happened.
That's what I find so amazing, that they told you were in the study, but they didn't give you any more information, and you were on your own to kind of investigate, Mrs.
But as far as what had happened, yes, that was pretty much it. The basic information. Yes, there was a study. Yes, the men were not informed about it. Yes, the men had, and then told them what the men had syphilis. But all of the men didn't have syphilis. So there was a lot of confusion. And I tell you, there's a lot more that we can learn from the study and as to what happened. For instance, in a lot of your readings and research, you will see where it was only 600 men in the study. Where if you would look at the names, and the names are listed on our website, each one of those men names are listed according to the CDC. And recently, I counted the men who were in the study, and it's 625 names on the study. The foundation, we used the 623 because that was closer to what we had found that was more accurate than the 600 men, because you're leaving out 25 men. So you don't want to do that. You want to give all the men the honor and the respect that they deserved.
Absolutely. And so often in these studies, they just have numbers and no other identity.
Absolutely.
Carmen, you knew not just a man who was a number. This was your grandfather. Can you tell us about your granddad?
You have to unmute, Carmen.
Certainly, you've heard the saying, it takes a village to raise a child. Well, if it takes a village, then my grandfather was the king chief. He had just around 30 grandchildren, and I was sort of at the very end, one of the youngest. And he took such pride in all of us and having so many grandchildren. He took pride in us. He was a fierce protector. He was a tremendous nurturer. He made the best chicken and dumplings, and he was he was my hero. He is my hero. My grandfather, my family migrated north to Connecticut in the late 50s, early 60s, I believe, which is where I was born and raised, and my mother and father worked. He was quiet. He loved to farm, even he didn't leave. He brought that to Connecticut from Alabama. He had a huge garden in our backyard and grew everything, including rutabagas, which I did not like to eat. But just a tremendous man with a lot of wisdom, quiet, patient, reserved, but a lot of emotion and a lot of pride there.
Carmen, we talked about the devastation, a little bit about the devastation that your mother certainly felt, and obviously your grandfather, but people may not realize how trauma moves through generations. Could you tell me a little bit about, how this impacted your generation?
Absolutely. And I'm so glad that we're having that Roxbury Presbyterian Church and you, Dr. Walker, saw fit to have this conversation, because it really is, we're at the intersection of faith and medicine and past and present. And we really need to talk about these things in the African-American community to sort of move forward and bridge a better path to the future. And so I have been working in public health for a very long time, over 20 years. And we know that past traumas can get carried on through generations in what many are now calling intergenerational trauma. And it impacts families, it impacts communities. And that's really what we're seeing with the hesitancy with this vaccine. The reason for it, I mean, we could probably coin it intergenerational trauma. It's, you know, stressors, it's oppression, it's obstacles, it's violence that one community, abuse that one community or one family has experienced in one generation that gets passed down because of reactions or the way people perceive or carry out life that sort of gets instilled down generations. And I think that's what we're really seeing with why the African American community isn't participating in trials, willing to get this vaccine, or even really being trusting of medical care, because there's intergenerational traumas and there's knowledge of past abuses. You know, certainly the syphilis study isn't the only issue or situation where African Americans were abused or taken advantage of or lied to. Certainly is not the first experience or the only lesson in history where this has happened. It's happened in many other instances, like the sterilization studies into South Carolina, the Henrietta Lacks story. The list really just goes on.
If I may just interrupt, how did it make you feel when you first heard about your grandfather's troubles, this trauma?
Well, you know, that's a really very interesting question, because I learned about the experience really when my family was finding out about it. I was very young, but probably a little bit too young to comprehend what was going on. You know, I was a child of the 70s, maybe 5 or 6 or something like that, when everybody was really finding out what was happening. And then several years later, my mother was talking at my grandmother's church, Mount Olive AME Church in Waterbury, Connecticut. And she talked about the syphilis study. And in her talk, she talked about the number of African-American physicians and the lack thereof. And I knew at that moment that I would be involved. I grew up wanting to be an obstetrician gynecologist, but I knew that I would be involved in addressing this issue in some way in my lifetime. And I have gone on to dedicate my career to my grandfather, and his experience is why I have gone on to participate and work in clinical trials. One time I worked as a voting member of an institutional review board here in Washington, D.C. And every role that I've had since I finished my undergraduate program at Howard has been involving public health, high-risk behaviors in youth, and health equity in some capacity. I currently work at a National Medical Association, the American Academy of Child and Adolescent Psychiatry, where I oversee our research awards. We provide an extensive portfolio of awards to medical students, to early career investigators and child fellows to support them in becoming better physicians. And we have a new initiative that really is all about diversity. And so we're committed, and I'm professionally committed, to increasing the number of physicians who are of underserved or come from underserved or minority backgrounds, and in making sure that we have a physician and healthcare workforce that reflects the community.
Gloria?
Yeah, well, that's so exciting, and I can well imagine that your grandfather is in that cloud of witnesses right now, smiling and cheering you as you run this race. I want to now move to you, Dr. Crutcher. Your organization has worked to turn something that was a tremendous tragedy into something positive for generations such as Miss Carmen there. Can you tell us more about your work with the Voices?
Thank you. Thank you so much. I I'm touched and heartened by this experience with my cousins. My first cousin, Lillie Tyson, who I grew up next door to. Her father's name is Uncle Freddie Lee to me, Uncle Freddie Lee Tyson, and I'm not sure whether we've even called his name. But when I was doing presentations at Harvard, I would call his name, and then I would call a number that CDC had posted. And I said, but to me, Uncle Freddie Lee was one of the most kind, gentle, caring human beings that deserved a place, a special place on earth. And Lillie and Carmen, I don't know whether you know this, but your father and your grandfather's birthday and our daughter Sarah's birthday is on the same day, October 1st.
I knew that.
So I just wanted to say that. I want to have our listeners know that he had a community, Carmen mentioned village, and we were a village of relatives who took care of one another. And so we honor not only my uncle, but we honor the 625. Lillie is always educating us. I had 623, and now I honor 625 men by sharing with you that this foundation has established a scholarship. And the scholarship is to honor our descendants, but also to help people like Carmen and even myself, because I have a degree in public health, but to have our young descendants go into the healthcare field. And since 2018, we have honored our descendants by awarding 16 scholarships.
That's wonderful. That's wonderful. Let me ask this to all three of you. You have turned this around. You have turned something that was traumatic into a triumph with your scholarship fund and with your program and this legacy. But do you ever get bitter? Do you ever get just weary? Because here we are again. We have gone through all of these trials and all of the suffering. Mrs. Head, first I'll ask you, do you ever think, my God, when is this going to end? When are we going to get to a better place?
Initially, I will ask that question, but I do not remain in that space, because that's negative energy. And I can use that energy to do something that's positive. I like to say that the descendants of the men, when we would meet at Tuskegee starting in 2011, we began to participate in a healing session by Doctors Ann and Ed Wimberly of Atlanta. And we participated in those healing sessions. We have been ever since 2011, which has been quite helpful. With helping us to understand how you move from trauma to honor and also to triumph. And that's where we are. If you remember, there are sayings that there's always nothing, or there's nothing new under the sun. And if you think of that in relationship to where we are now, here we are, and here this has happened at some point in time before in our lifetime. But we have learned that there are better ways because things are different. And there's more information now about the vaccine. There is still troubling situations about where we are as Black people in the health disparities and also in the systematic racial injustice. So we can learn and we can grow, but I always felt as though that we shouldn't dwell always on what we cannot do, but we look to what we can do. And this is something that we can do, is to transform that legacy and tell our father's story and tell the whole story of the study. when I asked my father how he felt about being in the study a few days after we had learned of this, my father said that, and as my daughter has mentioned, that he was a very kind man, very calming, and also a man of wisdom. He said that I can't do anything about what has happened to me and all of those other men. Said, but it's up to you all to make sure that it doesn't happen again. So that's what we are trying to do. And my father was not unlike any of all of those hardworking, resourceful, caring, loving men that were in the study. And that's something that I really want our listeners to remember. They were loving fathers, brothers, cousins, grandfathers, great-grandfathers, pillars of their community, you know, leaders in their community, and they love their families and they love their country.
Words. Reverend Gloria, you got a question? Because we're going to, unfortunately, almost out of time.
I know.
Yeah,
And there's so much more.
There's so much more.
That really can be talked about. Especially one thing I just like to say for those listeners who might have heard or still believe that the men were injected with vaccine, they were not injected with vaccine. So that's a myth. And I have heard people say, oh no, with the COVID vaccine, oh no, they're not going to put that poison in me. So I want to say that was not the case. They were truly abused and victimized in that study, but they were not injected. So don't believe as though something is going to be put in your bodies with these vaccines. And I would like to encourage everyone to consider if they can tolerate it to get the vaccine, because it's so important. It is devastating our Black community. And we really need to get involved and help and make sure that it doesn't continue.
Can I just have maybe just one other question, and either for you, Carmen, or Dr. Crutcher? You know, these are definitely trying times. It's hard to keep your head up sometimes. I wonder what, in the midst of all that we're seeing, gives you encouragement from day to day?
Well, for me, it's actually going back to the scholarships and the students who are aiming to change the attitudes and the health field and build trust in taking care of each of us on present tonight and those we don't see. The more we have in our world people who look like us, I think the more we can do more healing and more trusting of the medical care field.
Absolutely.
And I would say for me, it's my work because it is really very much related to what needs to happen to bring about change with supporting and growing the physician workforce. But I would also say that this challenge and this obstacle, like with every challenge and obstacle, lessons, lessons are learned and there's growth. And the Voices for Our Fathers Family Legacy Foundation has grown, with how we respond to requests for these types of programs and how we may even shift and develop and moderate some programs ourselves in the future. So this is just really very exciting for us to have the support. We've had a lot of people reach out to us to say thank you so much, asked us to come and participate in these types of platforms and learning opportunities. And there's a lesson there, and we have a message, and we're just glad to be able to share with all of you.
Mrs. Tyson had told us that she thought people should, consider taking the vaccine. How about you, Dr. Betty? Because we've never taken a poll to see if everybody's on the same page.
Right. When we were talking last week, I still had mixed emotions, I guess a couple of weeks ago, but I have taken the vaccine. My arm was sore. If you want to say, okay, how did you feel afterwards? For a couple of days, my arm was sore. My husband and I took the vaccine on the same night. Ron Crutcher and I took the vaccine on the same night, at the same time. The nurse was terrific, so we had a very good experience. And we will be taking our second vaccine in February 17th.
All right.
So I said mixed emotions a few weeks ago, and now I'm encouraging people to take the vaccine. But I think that should be everybody's choice.
Excellent. Carmen?
Well, I haven't taken the vaccine, but not because I don't want to. It's just not available to me at this time. So I've registered with the appropriate website, and I'm hoping that we'll hear, my husband and I are hoping that we'll hear some news where we can move in and get our vaccinations as well. But, you know, in my social network of friends and colleagues, there's still people who have plenty of concern. And I have physician friends, I have dentist friends that still have concerns about the vaccines.
Okay.
There's still a lot of work to be done.
Absolutely, and I think the point that you've made to us is the importance of informed consent, so that people have the information they need from credible sources and make their own decision.
Well, I want to thank you all, and we want you to stay with us. We just want to get into some of the questions about the vaccine. It's important to know the history, as Ms. Head told us earlier. If you don't know history, you're condemned to repeat history. And so we're just trying to focus on history, but we also want to know what's going on right now. The numbers are changing, as you saw at the beginning of this event, but there's still a number of people of color and others who are skeptical about taking the vaccine. So joining us to talk about vaccine hesitancy and to give us some really late-breaking information on the vaccine, we invite Dr. Simone Wiles with us, who's currently working as an infectious disease physician at South Shore Hospital, a member of the governor's working group on vaccine distribution, a clinical assistant professor of medicine at Tufts Medical Center, and chair of the Committee on Diversity with the Massachusetts Medical Society. And we also welcome a good friend, Dr. Alice Coombs, an anesthesiologist, and she's in intensive care from Virginia Commonwealth University Hospital. She is also on staff at South Shore Hospital, and she's a community advocate for vaccine education. Are you with us, Dr. Coombs? There you are. We thank you both for joining us. These are doctors who are on the front line. We thank you for the work you're doing, first of all, on this vaccine and on COVID. And Dr. Wiles, my first question is, one of the biggest concerns right now, of course, is what we're hearing about this mutation, the variant in the COVID-19. How concerned should we be right now about that? Dr. Wiles?
Reverend Liz and everyone, thank you so much for having me. This is a very important topic that's been discussed these days, the new coronavirus variant. I just want to give you just a brief background. Viruses mutate, which means they change their forms all the time. So that's not unusual. And the same goes for the coronavirus. Now we have a number of different forms of the coronavirus. You've heard about the one in UK. There's one in Brazil, and there's also one which is even a little bit more worrisome in South Africa. And the reason that these variants are concerning, it's because it's going to change how the vaccine, how we respond once you've given the vaccine. And so the key thing is that there's more studies that need to be done to follow to see how many variants we have. So there's a lot of studies that's going on right now. But the really important thing that I think everyone needs to know is that the vaccines that we have right now, they are effective against the variant. So when you're eligible for your vaccine, I'd advise you to get your vaccine and get it quickly, because things are going to change in a few months, maybe even a year, but we anticipate that things might be a little different as we learn more information.
You know, Dr. Wiles, one of the concerns that I continue to hear is the extent to which this vaccine seems to have developed so quickly. We've heard about the warp speed. Can you give us some background about it? Should we trust it given that it was just 10 months in the making?
Yes, that's really important to make sure that everyone understands what's happening. Now, we've all heard about the messenger RNA technology. So this is something new, but they have been working on it for many years. They have been doing work with SARS, with MERS. Those didn't come to the market. So now that they have found a virus that works, they have been able to incorporate this new technology. So it's not something that they just started when this started a few months ago. This has been going on. It's a process. So we can feel comforted that, this process has been tried, it's been examined closely, no protocols have been compromised, and many people have been working diligently, and there's been a lot of money that's been put, so things can move a little faster. The data shows that the vaccines are safe, they're effective, and at this time, again, we are just dealing with so many cases of deaths in the Black and Brown community that I think we really need to make sure we take some aggressive steps to make sure we can make some changes.
Let's talk about the deaths and the sickness. Dr. Coombs, you are working with COVID-19 patients right now. What are you seeing in the hospital that you serve?
So I'd like to take a little bit from what Dr. Wiles has said. This is a virus is very light and feathery and exists in the air for some period of time. The original studies in Wuhan showed that the virus was everywhere on top of computers at vent sites. And so when we talk about how this virus affects us by causing disease, it's inhaled and it has a proclivity to go to the lungs. It wants to hang out in the lungs, binds to the lung tissue. So in the hospital, we will see patients who come into the emergency room, and they'll be in several different categories. Some of them will come in with mild disease where they're short of breath and they need a little oxygen, and they stay there. Maybe they are in the hospital for 2 to 3 days. There are others that have a little bit more aggressive disease and they need a lot more intervention. And we found that even in the early phases in the moderate disease, if we put them on their tummy and the lung has different kind of response in terms of improving oxygenation, because their oxygen level goes down, because this disease, the virus gets in the lung and it causes like a seepage, an angry storm is occurring in the lung tissue. And so as much as that happens, it could stop and somewhere in the middle part in terms of being moderate disease, or it can go on where it actually causes the lung to look more like a liver. And it gets so inflamed that we have to put these patients on a respirator. And so actually having to ventilate these patients becomes a real problem. So while COVID has a proclivity to affect the lungs, because it affects the oxygenation, it affects every system in the body, including the brain. And there are people who've had COVID and they say afterwards they have a foggy brain syndrome. I mean, there are many things that are a consequence of this. So what do I see? Last night I was on call in the ICU at VCU. VCU does an incredible job of caring for the most vulnerable population. And of the patients that I had, 100% of them on the ventilator were African-American. And they range from age 42 to 72. And it is really, really a difficult task balancing everything from getting their oxygen up to keeping their blood pressure up. And once their blood pressure is up, if their oxygen or any of the other things changes, then they can have problems with their heart rate and they can have problems with their kidneys. So having COVID is really a very complex disorder. People think of it as just, oh, I got a cough, I got a fever. Much more than that when you come to the hospital. Bottom line is, how could you prevent it? Take the vaccine. 90%, at least 90% to 95%. You can actually decrease your likelihood of having to make that decision. Making one choice leads to a better outcome. And so I'd like to say that in the hospital, we're doing everything. And we've actually found a common bond. In the middle of the night last night, I'm actually talking to the nurses about the patients and, also sharing, because it hurts. When you have a patient who passes away with COVID-19, there's no family members there. I've actually taken my phone, put it at the door, and let someone speak through the door to their loved one. And that's all they had. So when you make the choice to take the vaccine, guess what? You provide your loved ones with a better situation in terms of them having to make another choice. So the choice to take the vaccine is better than not to take the vaccine, because it's not just your atmosphere, it's also what you actually transmit to other people as well. So I like to say that that's really important. It really is. Thank you.
Thank you. Don't go away.
Yeah. So you know what, Dr. Alice, when you talk about the importance of getting the vaccine, not just for you, but for others, many people, Dr. Wiles, have talked about this herd immunity, population immunity. I've heard Dr. Fauci refer to a blanket of protection. Can you tell us what that is?
Yes, that's really important. And I'll make it as simple as possible. And what it is that we want to get as many people vaccinated so we can protect others around us. And I know Dr. Fauci has said, 75 to 85. The key is we want to get as many people protected so the few that have decided that they don't want the vaccine can have protection. Hence, we can get back to normal or whatever our new normal is going to be. And I will tell you again, in the Black and brown community, if a lot of people don't take the vaccine, then we won't get to herd immunity, right? And there will be more deaths. So that becomes really important. I know the data said recently that, the uptake for vaccines in the Black and brown community was very low. And so we really need to get more people to get the vaccine so we can get this group vaccinated to get everyone protected. So again, as Dr. Coombs and everyone has been stressing, when it's your turn to get the vaccine, you're not doing it for yourself, but you're doing it for everyone else in the community.
Well, Dr. Wiles, let's talk about the reality of the vaccine. There are some side effects, and people are very worried about the side effects. How serious are the side effects of the vaccine?
Well, I'll tell you, the side effects are really mild and short-lived. So, there are 2 doses that you get, the Pfizer and Moderna. They're both messenger RNA vaccine, and the side effects are very similar. So after the first dose, people will complain of pain at the injection site. They might have fever, they might have headache, but those usually last for 24, 48 hours, and then you can get back to your regular activities. When you get the second dose, the side effects might last a little bit longer, but again, they're short-lived. So even if you have to spend a little bit of time at home, you can still go back to your daily activities. And again, when you weigh the pros and the cons of getting the vaccine versus getting COVID, for me, that's an easy choice. I got the vaccine. I was able to tolerate it fine. I was able to get back to work the next day. So, we tell people so they're not alarmed, because people might get really surprised, but, we tell you so you're informed, so you can go get it, anticipate that, and then get back to daily life.
And isn't it true too that the fact that, and I've heard this as well, that second shot is sometimes the reaction is stronger than the first one. And that's an indication that in fact your body is responding well, that when you expose to the virus again that second time around, or at least to the component of the virus, the fact that your body reacts is actually a good sign.
Yes, absolutely. Your immune system is working effectively. So, we're not alarmed when we hear people say, oh, I was really sick after the second dose. Does not mean you have COVID. And I want to point out here, it's not a live vaccine, so you cannot get COVID from the vaccine. So just be very clear about that.
So just
so important, yet there are still people, and our numbers look really good tonight. Those are anecdotal numbers, of course. We can't give you the demographics for those numbers, but those numbers are very promising. Still, there are people who are not taking it. And Dr. Coombs, I was shocked to find out that some healthcare workers are hesitant to take the vaccine. Have you seen that in your facility, Dr. Coombs?
Well, yes, and part of it has to do with some of the information, and it was mixed messages when the introduction of Pfizer And I'll be honest with you, I was like, okay, can I have one that just is one shot versus two shots? And as Hamilton says, I'm not going to throw away my shot. So I took both shots. But and I actually talked to the smartest woman I know, which is Dr. Harris, if she's on the phone. And I asked her a few questions about just the strategy for how they made the vaccines. And the vaccines are made slightly different. But the impact of what you want to see done in terms of preventing that little antigen from actually going in your cell, that whole idea, it permeates all of the vaccines. So as long as you have that piece, that's the most important piece. And there are different ways in which they've actually made the vaccine for the next round that's coming out, the J&J. But I think the most important thing is we got to have immunity. This is so important going forward. It really is, because as the infectivity in the community drops, then we have a better chance of actually getting people back to their baseline livelihood. They can do the things that they normally would do, and then you don't run the risk of just this spread that actually is exponential, where you have all these circles that are just kind of intersecting and interloping, and if you travel, that's one other issue in terms of being able to spread viruses to new areas that, you know.
But the question was, do you see people who in the hospitals who are not taking the vaccine? And Dr. Coombs, you may not.
There are some that I've talked to.
Talk to them?
Yes, and yeah, and I talked to them, and they're concerned. But I will give examples. And one example I give is the New England Journal had this case of measles where someone is traveling internationally, and you know, in other countries, they don't require measles vaccination. And someone who doesn't believe in measles vaccinations actually was traveling and actually contracted measles. And measles is a very ugly disease if you get it. You never know what circle you're going to be in. So I actually use that argument with people who are healthcare workers. And, you know, sometimes people are persuaded to change based on that, because you have to look at history, and we've had vaccinations in history. We have polio vaccinations. We've gone through this already. And this is no different than the vaccinations before. Yet you don't hear people saying, I'm not going to take a polio vaccine. You do hear them talk more about measles vaccinations. But I think that people are more likely to do what they've done in the past, which is to take vaccinations because they are preventing disease states. So I think if we can actually compare what we've done in the past and say, yes, it is a new normal, but we've taken vaccines before.
Mm-hmm.
You know, I think this is, you're reminding me, Dr. Alice, of what we appreciate is just how deep-seated this the racism is, the trauma associated with racism, and even when people get educated, even when they're working in the field, the suspicion is just so profound. Well, one of the concerns, of course, about this vaccine is were there any Black people involved in making this vaccine, and that's what's so unusual about this vaccine. I wonder, Dr. Wiles, if you can talk about the extent to which Black people have been engaged in the development and rolling out of this vaccine.
Absolutely. We have all heard of Dr. Corbett, who has worked with Dr. Graham, who was on the call with us, and she has been instrumental in working with the Moderna vaccine. And, you know, when they were doing that trial, they at one time paused the trial because they said there weren't enough Blacks, and they recruited. I think they got 20%. Of course, you always want greater numbers, but they were able to get 20%, and Pfizer also was able to get Black. So there is a lot of Blacks that were involved in the clinical trials. So that gives me some reassurance that one of the lead scientists worked on this vaccine, and we had our race really being involved in the clinical trials. So that for me gives me even added benefit that, you know, my group is well represented. So it's not like just an isolated group that was a part of the clinical trial.
Yeah, I think that that's really important for people to understand, that all along the way, that Black people have been involved, have been invested. I can think of the president of Meharry, Dr. Hildreth, who was one of the scientists. He's done a lot of work with HIV research, and he was very integral to watching each step along the way, and that even that there was nothing that was rushed. This was an example of people collaborating to make the development so efficient. But people have been involved from the developing stage to the trials, to the distribution, and that is important to understand. We've got a long way to go, and our trauma is real. Nobody's crazy here. What we know is what we absolutely know, but we're not going out this way. We've been a part of this vaccine, and we're gonna survive.
Let me ask this to all three of you. On top of the issue of vaccine hesitancy, there is now, as we all know, a lot of confusion about the vaccine distribution, about the vaccine availability, about how we're rolling this out, about who's getting it, which neighborhoods. Do you believe that we're going to get past this? Are we going to get past this quickly? Are you at all unsettled by all of the confusion that we're going through right now? Or is that something to be expected in a project that has never been tried to this level? I'll start with you, Dr. Wiles.
So I just want to share that, I've never been involved in a pandemic. I've never been in such a real crisis situation. And I'll say working on the governor's board, Reverend Walker's part of it. And we've had some real difficult decisions to make, really topics that are really challenging, but we've always used equity as our guide, which is something that I'm really grateful for. I mean, there've been a lot of hiccups, but I think people are learning as we go. And I really hope that, as we learn from the mistakes, we're going to take steps in the right direction. And it's my hope, but I am the optimist that things are going to get better. Things are going to get better because we cannot stay in this zone for a long time. It really, takes all our energy. And so as we get more information, I am doing my part in trying to get information to others so they can make informed decisions about the vaccine. And I think that will go a long way in guiding people as they try to decide, should I or should I not get the vaccine? And it keeps me up at night. But we're getting there. I believe so.
Well, Dr. Coombs, are you still optimistic? Sometimes to
I'm optimistic because I think the circles of influence are greater than we can imagine. And we're fighting a war against something that's like a few microns, a fraction of a micron. We're actually in combat. And I think because who the enemy is the virus, I think that we can overcome. It's not going to be easy because what we're dealing with is a lot of cultural impact. The cultural aspects of each group that comes to the table has different priorities. But I think we're getting to a better place. I really honestly think that we're going to be at a better place by the end of 21. We will probably be looking back on the situation and saying, thank God that's behind us, and move ahead. I really do like the idea of where I am right now in this very moment that we're having this discussion. I appreciate the legacy of the three speakers. And I think it just propels me. I can't tell you how encouraged I was by all of the speakers earlier. And it's something that I never thought I'd have an opportunity to be on the same panel. And it really inspires me to do more of what I should be doing as a physician. So thank you.
Well, thank you for that. Reverend Dr. Gloria, do you want to do that? And I'm going to ask the other ladies, if you're with us, to please come back because we're going to wrap this up in a few minutes and you may have some questions for our doctors. But Reverend Gloria, do you get lost in this, not lost, but perplexed about all of the confusion that's going on now with the vaccine dissemination?
Well, obviously, I'd say our last administration did a very poor job in terms of obviously advising us about about COVID-19, and the whole rollout was just very poorly done. I'm encouraged with this administration. I think that their equity will still be a problem. We have got to stay on the battlefield. People need to be watching in their local communities. We need to know that there are more places where people can get testing done that are easily accessible. We need to watch the vaccine distribution. It's not going to be equitable if we don't continue to make noise about it, watching it, advocating. One of the reasons I tell people we need you to survive is not only because we love you, you matter to our community, but we need boots, we need people to march and protest. We need voices to speak out. We need hands to comfort one another, and we need your vote to get the wrong people out and the right people in. So I believe that we can do that. It's going to take work.
Absolutely. Do you, Ms. Head, or Ms. Thornton, or Dr. Crutcher have any questions for our doctors? Or I don't know, I hope you heard what Dr. Alice just said about how honored she was to be with the three of you as descendants of such an important moment in history. But I wanted to give you the opportunity if you had any thoughts or questions for the doctors or comments before we wrap up.
Thank you. And thank you so much, Dr. Coombs, for that comment. That really warmed my heart. I guess this is more of a comment than it really is a question. And it's really, I think we as a we're facing dual pandemics. There's the pandemic of racism, and then there's this pandemic of COVID. And, I think racism has fueled, health inequities in this country. Racism has fueled, all of the issues that we see across a number of different social structures, education, or salaries, everything. And all of that helps to breed, issues with differences in healthcare. And so I guess I'm just a little bit curious to hear from the providers here, the physicians here, and how you and your personal practices are working to touch and address health equity.
So I worked probably 20 years with the Commission to Eliminate Healthcare Disparities, either on the American Medical Association. I worked for the Governor Deval Patrick back in the day. But part of this whole conundrum with vaccinations is the sense of whenever there's scarcity, we are at the bottom of the barrel in terms of appreciating something that we should be entitled to. So we think of entitlement in other ways, but this is truly, we should be entitled to get this vaccine because we're adversely affected by it. So one of the things that I really feel strongly about is patients having total informed consent and just being upfront and honest about everything. So whether it's treatment to be intubated or it's the end of life care. So that's one of my things that I really want to make sure the patients feel like I had a choice in the matter and I had equal access to therapeutic interventions that may not have been discussed prior. So I think that's really important for me as an invasive intensive care doc. I want to make sure that that doctor who is a specialist says, did you know you need a cardiac catheterization and we're going to do it on you. And I'm not going to talk you out of it. So and the same thing goes for, access for vaccination. Make sure there's internal consistency as to whatever policy you have in terms of your steps of who gets the vaccine next.
Thank you, Dr. Coombs. Dr. Wiles, we've got less than a couple of minutes and we try to honor the time. Could you just tell us could you answer that question that Carmen asked?
I'll make it real brief. One of the roles I serve is on the chair of the Committee on Diversity for the Mass Medical Society. And I think I use that office to make policy changes so that you can have a broader influence across the Commonwealth so that people are at least thinking more about racism as a public health crisis and doing more across the board so that everyone, in particular those in the communities of color, get the attention that they need.
I want to thank you, Dr. Wiles. I want to thank the ladies from Voices for Our Father's Legacy. for joining us and telling us about the importance of history and what they're doing now. We want to thank Reverend Dr. Gloria White-Hammond, Alice Coombs, all of you for joining us. And we hope that we've given you, our viewers, some more information so that you can be informed on your decisions about anything and everything, but particularly about this vaccine. We're going to quickly take that poll again. We already started with 89%, but let's quickly take it again and see if anybody's mind was changed. If you, as it stands right now, are you planning on taking the vaccine? It only takes a second to tell us yes or no. We had 89% at the beginning. We hope that it remains that way. Judelle, let me know when you have some answers. I'm trying to stall so that we can get those answers in. But this is important. This just gives us a way of understanding who's listening and how our talks are affecting people. So if we have, well, it looks like we got a little bit more. We're getting closer to our goal. So that is really good. That means a few more people decided that it is important.
That's wonderful.
That's
Wonderful. Thank you.
Thank you. So thank
The last thing, yes.
our
Thank you.
of tonight's events. We want to thank Bethel AME Church. We want to thank Voices for Our Father's Legacy, Boston Medical Center. We want to thank Massachusetts General Hospital, Blue Cross Blue Shield, Massachusetts Health Council. This event has been recorded and you will be able to get it. We make it available to everybody who comes on. And with that, my prayer is that we are getting through this. We are moving through this. We will get to the other side. Weeping may endure for the night, but joy comes in the morning. Thank you for joining us, everybody. God bless. Be safe.
Thank you. Bye.
Yeah. Thank you. Bye-bye.